let me tell you what I'm planning to talk about, and then you can tell me if there are some things that you want to know about as well, okay? I'll talk about the tax bill and what's going on with that. Talk about the marketplace and the ACA mandate. And then I'll talk about Medicaid and Medicaid expansion, particularly at the state level. Are there other things you're kind of interested in hearing about in terms of healthcare? Something on your mind? Okay. Yes, ma'am.
Yeah.
I assume you covered, what do we know is happening and when?
Okay, sure. Okay, so let me start with tax bill. I'll try not to wander too much here. If I don't wander, it'll mean I'll wave my arms a lot. So sorry about that in advance. So first is let me go back one step with the tax bill, but also to talk about the repeal efforts, because I think the context of that is important. The reason that we have this dilemma about the number of votes in the Senate is that generally the Senate has a rule that requires that there is 60 votes to pass any legislation. The only time that rule is waived is when they do what's called a budget resolution. So they basically created a rule within the Senate that says anytime we need to really revise the budget, if we pass a resolution that defines that we need to make changes, then any legislation based in that resolution only needs a simple majority. Now, in the Senate, the Vice President gets a deciding vote, so if there's a tie, 50-50 in the Senate, then Vice President Pence can break the tie. So ultimately, you need 50 votes, but knowing that the last vote can be passed by the Vice President. A budget resolution can set forth changes to three things: either taxing, spending, or deficit. And it can do all three of those things, okay? So relatively soon after the election last year, or I should say after in January, the House and Senate passed budget resolutions that called for changes in both taxing and spending, and they described that they wanted to see those taxing and spending changes impact on healthcare, and they defined that. That's why you had this fight for almost all of last year about how they could create a change in taxing and spending that impacted on the ACA, okay? And it sets, when they do that, it sets forth parameters about how much money they need to save, which committees have to see the legislation and otherwise. But, that's really just about those process pieces. That debate about healthcare lasted all the way until September 30th. And the reason that ended at that point in time is the Senate parliamentarian, the person who decides how the rules of the Senate are interpreted, said, look, you cannot pass a bill affecting the 2017 budget after the 2017 budget ends. And the 2017 budget ended September 30th of 2017. So that's why the healthcare bill and all of that process around that basically terminated at that date. They were unable to secure enough Senate votes, and time ran out for them. So what they ended up doing is going back and saying, okay, the next thing in our agenda was tax legislation. We will pass another budget resolution, and that one was focused on tax. They used the 2018 budget year because they already had a continuing resolution for 2018, and they defined that they wanted to see $1.5 trillion in cuts to the deficit, in basically saying we only want we want to have $1.5 trillion less in revenue coming in through taxes. That was their parameter for it. So that's why when we get to this figure about there being a cut in the deficit, they are trying to fulfill the terms of the budget resolution. And so that's where this bill is coming from. That's why the Senate still, in this case for the tax bill, only needs 50 votes plus the vice president to cast a deciding vote. Okay. With the election in Alabama, the difference now is 51 Republicans, 49 Democrats. So still, if all of the Republicans sign on to the tax bill, they have that margin. Even with Corker abdicating, that's still 50 Republican votes with a Pence getting it at 51. So why is this tax bill important to health? It's important for basically I'll say three things. There's probably a few more. The first is the deficit. So when the budget resolution was passed, which allows for this legislation, and they asked for those trillions of dollars in cuts to revenue, they defined how they foresaw the cuts in spending to occur. And that is about $1.1 million out of Medicaid and about $400 billion out of Medicare. So that's not in this tax bill. But when they say, oh, there's this, they don't talk about the deficit they're creating, but they know what the plan is for how they're going to fix that deficit. And that plan is to cut both Medicaid and Medicare. Once they pass this legislation, that resolution has been addressed, they could pass a new budget resolution, again allowing them to do that 51 vote margin in the Senate. Okay, so you can't have more than one resolution that you're acting on at a time, but once you've done one, you can go back and do it again. So there's no limit on the number of resolutions that can be acted on for any particular budget. They can keep coming back. You can only have one resolution sitting open at a time, but once they close that one with passage of the tax bill, they could come up with another. So the tax bill sets up this large deficit that the resolution has already talked about how they plan on cutting spending. But the other thing that sits out there is there's a budget process called sequestration. And it was set up to specifically address when there was a deficit in the budget. And saying, look, anytime there's a deficit in the budget, you're going to, across the board, cut programs at certain percentages. And that's called sequestration. Medicaid and Social Security are not subject to sequestration, but Medicare is. And so if they, even without passing any other legislation, if they do not exempt the effects of sequestration, Medicaid will have to be cut 4%. That's $25 billion that will have to be cut from Medicare. Okay? So that's a do nothing and this happens, okay, kind of thing. The third piece that's, I lied. I just can't count on my fingers. The third thing that's in the tax bill is actually a positive thing, and then we'll close with the negative thing. But the positive thing is the House had gotten rid of the deduction for medical expenses over 10% of income. The Senate actually added in something that lowered that so that you only had to have 7.5% of medical expenses, 7.5% of your income as medical expenses could be deducted. It sounds like the Joint Committee, so the final bill looks like it will actually allow you to deduct medical expenses over 7.5% of your income. So that's a positive thing. So if you're, let's say your income's $100,000. If you have $7,500 in medical expenses, over that amount you can make those as deductions, okay? So that's particularly important for people that are in long-term care that are paying out, or people with chronic conditions that really cause them to pay a lot in medical expenses. Not a lot of people get to that deduction level though. And then the fourth thing, which probably many of you are aware of, is the ACA mandate to be insured, to have insurance. It's being typified as them getting rid of the mandate, but remember, the reconciliation language can only change how you tax, how you spend, and how your deficit is. So they can't actually get rid of the mandate. They can only get rid of the tax penalty. Now, without the penalty, you might believe, and probably rightfully so, that many people will ignore it. But that's it, unless they have changed it, and I don't believe they can. I don't think they can get it through the Senate rules. The real change is they're taking away the penalty. Okay. What will that do to the market? There's some question about what that will really do to the market in the future. Many of the insurers planned ahead that was not going to happen. That's one of the reasons. I think they estimated that was about 30% of the increase that occurred was due to the expectation that you would have a loss of these healthy people out of the risk pool. So